Thanks so much, Ali. Good afternoon, everyone. Happy Carnival, happy Valentine's Day. It's a pleasure to be back with you. Happy to have Theresa Sokol, our state epidemiologist, with us as well. I'm going to, in a second, share my screen and run through some slides. I'll go through an update on where we are with COVID itself, the usual virus update that we do periodically. We'll talk about some updated guidance in terms of boosters, particularly for immunocompromised folks. We'll talk about Mardi Gras and how families can protect themselves. And then Theresa will talk about revised school-aged guidance for K through 12 as well, strategies to help kids stay in school, minimize disruption, and to do so safely. I think that'll be welcome. So with that, let me get started. I'll share my screen and get going with this, and then we'll have plenty of time for questions on the back end of this. Okay, I'm going to get going. If my screen doesn't show appropriately, Ali, just chime in and let me know. As you can see from this first slide, which is incidence, the number of new cases that get diagnosed day on day end, we clearly have peaked. We knew we've peaked for a few weeks now on this Omicron surge, and we've come down quite steadily. This continues to be driven almost exclusively by the Omicron variant. Over 99% of new cases, both statewide and nationally, are still from the Omicron variant. We've come down relatively steadily. There's about a week delay in this data here, so we're actually a little bit farther down this slope than able to display on the graph. But we've come down steadily, and that really factors through all the other data measures I'll show you in a second. For the past week of measure, there's been 314 new cases diagnosed per 100,000 residents over a week's time. 314 over 100,000. That's down from 597 the week prior, and a couple of weeks prior to that, we peaked out at well over 1,000, closer to 2,000. So we've, again, on one hand, this has been a peak, a surge of a magnitude significantly more than anything we've had prior. And the same thing goes for the country. On the other hand, we have come down relatively steady. We've not yet seen any indication in the data that our rate of decline is being slowed either by the other Omicron subvariant BA.2 or by any increase from Mardi Gras or any other gatherings. We continue to make steady progress, and we certainly hope that continues over the next couple of weeks. What you see here is the typical 4-quadrant epidemiologist slide that we look at every time that we meet. All measures show continued progress. I'm going to walk through pretty briefly on a more granular level the different data points that we look at. On the top left, you see COVID-like illness. This is the percent of ER visits across the state that are attributable to people seeking care for symptoms suggestive of COVID. We've come down quite consistently from about 20% of all ER visits at the peak of this surge, now down to 4% of all ER visits attributable to COVID-like symptoms. Last week, it was 6.5%. So we're encouraged by that. I think that's reflective of a lesser load being borne by hospitals now, although as we'll talk about in a second, hospitals still are under a lot of stress. On the top right, you see the same incidence graph that we just zoomed in on in the slide prior, so I won't say anything more about that. In the bottom left, you see a combination graph. The purple line is testing volume, how many tests are being conducted across the state, regardless of whether they're positive, negative, or inconclusive. We've come down about 45% since the past week, and that's expected. As your cases go down, the need for testing goes down as well. They're hand in hand. So that's a decrease that we expected. Right now, we're at 357 tests being conducted per 10,000 residents per week. That's down from just over 400 the week prior. At our max of this surge, which was for testing volume the second week of January, we were at 568 tests per 10,000 residents per week. And that was the highest point that we have been to at any point prior in this pandemic. So you see that decline there commensurate with the decline in cases that we're seeing. The orange bars below that is percent positivity. Of all tests being conducted, what percent of those are coming back positive? We're down, we update these numbers every week, typically on Wednesdays. I'll tell you now what the number will be publicly reported tomorrow when the dashboard gets refreshed at noon tomorrow. That will be down to 9.1%. That's the preview of what the publicly reported number will be tomorrow at the noon dashboard update, 9.1%. That's down from 14.3% this prior week. That's down considerably from the peak of the surge, which was 29% positivity. And that was around the new year in the first few days of January. So we've come down rather consistently in percent positivity. On the bottom right, you see hospitalized COVID positive patients throughout the state. This is probably the graph that we care the most about because it's most reflective of how stressed our hospitals are. We peaked at 2,367 hospitalized COVID patients, this particular surge. We've come down consistently. Right now, as of today, we're at 1,088 COVID positive patient hospital beds throughout the state. Of those 1,088, 112 are on mechanical ventilators. That number has come down as well. Of all the 1,088 COVID positive people hospitalized right now, 69% of them are not vaccinated. 92% of them are not boosted. Hospitals continue to be very stressed, both because their overall volume is higher than it would be this particular part of the year in prior years, and because the staffing shortage is still very much in effect statewide and nationally, particularly amongst nurses and respiratory techs. Very hard to recruit new nurses, very hard to retain the ones that are currently working in hospitals. For that reason, we continue to support about 60 hospitals in the state with nursing support through state-run contracts. And that's a marker of how severe the stress is in the hospitals right now. We hope that stress will alleviate in the few weeks, but it's still the case that hospitals are stressed and they're very, very busy. Not reflected in these numbers, but certainly of importance to us is the mortality toll that this surge is taking on us. You know, deaths are a lagging measure. We typically don't find out about deaths until some days or weeks after they happen, and it takes some time for coroners to investigate deaths and report those investigations up to us in the state. We reported 42 deaths today. That's a significant number. For this surge, really since the middle of December, since December 15th, we've had 1,362 COVID deaths. And again, that's a lagging number, so that's going to continue to go up over the next couple of weeks for deaths that have already happened. That's significant. So I think when we talk about the Omicron variant being mild, it's important to know that that's an average. It's milder on average, but when you have this number of cases, this sheer magnitude of cases, those numbers still add up. You know, 1,300 deaths is still very, very significant. And I think we need to take stock of that. The risk of community transmission, how much COVID is out there in the community, continues to be at the highest of the 4 possible categories in all 64 parishes. The CDC has categories for community risk from low to high. Because we still have a lot of COVID out there, corner in the state, the risk of being exposed to COVID remains high. We expect that to get better over the next couple of weeks as we continue to come down from this surge. But it's important to note, while we are encouraged that we're moving in the right direction, we're clearly making progress, because our peak was so high, higher than at any point prior in the pandemic, both statewide and nationally, it's going to take some time to come down. And that's where we find ourselves right now, moving in the right direction, consistently moving in the right direction for the past 2 or 3 weeks. But because we were so high to begin with in this surge, it's going to take some time to come back down to baseline before the risk is really lower across the state. Talk a little bit about vaccinations. And on one hand, we're not where we need to be in Louisiana. 52% of the state's general population is fully vaccinated. That's not where it needs to be. There are some bright spots, and I'll walk through that. 85% of our senior citizens, 65 years of age and older, are fully vaccinated. 88% of nursing home residents are fully vaccinated. That's encouraging. And as the slide shows, we continue to have individuals who, for a multitude of reasons, did not get vaccinated prior in the past year, but chose to get vaccinated in the month of January. Over 58,000 people had their first shot in the month of January. These are people who did not get any vaccine for about 11 or so months when it was available and got their first shot in January. And over 134,000 people got boosted in January. So I remain encouraged. I remain encouraged that people continue to get vaccinated who did not prior to this in the pandemic. That tells me that it still has merit to have the conversations, the community-based conversations that we have, talking to people about what their concerns are, why haven't they gotten vaccinated yet, and try and bring facts to what their concerns might be. There still is merit in that, is what I'm saying based on these numbers. We still have a lot of work to do with boosters. So of the 2.4 million Louisianans who are fully vaccinated, only 37% of them are boosted right now. We know boosters are really important to give you adequate protection, particularly against the Omicron variant. As a raw number for the general population, about 20% of the state's general population is fully vaccinated plus boosted right now. That number needs to increase, particularly with what we know with waning protection from the vaccines. They do wane a little bit over time, and you do need that booster to give adequate protection against the Omicron variant. I wanted to note before I go to the next slide, there's been a couple revised guidance points from the CDC over the past few weeks that I want to highlight here in terms of who should get vaccinated and when. The general booster recommendation has changed from 6 months to 5 months. This is for the general population. So at this point in time, anyone who got their second shot of Pfizer or Moderna 5 or more months ago is eligible and recommended to get boosted now. That's shortened from 6 months of what the initial recommendation was, now down to 5 months for the general population. The other big change has to do with people who are immunocompromised. These are people who have conditions that render their immune system moderately or severely impaired, particularly people who are on chemotherapy, people who are on chronic high-dose steroids, have some other conditions. They should get boosted at 3 months after their second dose because their immune systems need more of a boost. I'll also note that as of this week, individuals who receive what we call passive antibody therapy, people who had COVID and either got monoclonal antibodies or got convalescent plasma, they no longer have to wait to get a booster dose or a vaccination dose. They can get that once they're done with the acute illness phase. The prior guidance is that people that got monoclonal antibodies had to wait 90 days. That no longer is the case. So if someone got monoclonal antibodies because they're COVID positive, they can get boosted once they're no longer sick. Let's talk about Mardi Gras for a second. It's happening. At this point in the pandemic, and this is our 24th month of pandemic response, we have a lot more tools to protect ourselves than we had before. We have better masks. We have better and more therapeutics to treat people when they do get sick. We have vaccinations. We have a better understanding of how this virus spreads. Mardi Gras is happening. There's no question about that. So families need to take stock of what their own risk is and make good, educated, responsible decisions about how, when, and where to engage Mardi Gras. People can be safer in the Mardi Gras season, but at any point in time also. Right now, if they mask more and they mask better. That means if they're in a crowd, either indoors in a public setting or outdoors in a thick crowd, masking will increase their safety. If they wear a higher quality mask, that will provide more safety. KN95s or N95s are the best that people can wear right now, and they're pretty easy to get right now. And if they wear a mask that's well fitted, that will increase their safety. So, whether it's Mardi Gras or a game or anything else right now, our recommendation is if people are indoors in a public space or if they're outdoors in a thick crowd, they will be safer if they mask. That certainly holds true while we're in a surge And again, for the next couple of weeks, we're still going to be in a surge as we come down. Families are safer if the members are vaccinated and boosted if they are eligible. Again, as we just showed, it's never too late to get vaccinated. We continue to have thousands of people that choose to start their vaccination series. So there still is room to do it. I mean, no one should be discouraged just because they haven't done so yet during the pandemic. People should stay home if they are symptomatic, and they should get tested. And if individuals are higher risk for severe disease, these are people who are at an advanced age or people that have significant underlying conditions, they should consider if they want to go to a large event at all. The risk is not zero. Even if vaccinated, even if masked, there is some risk in there. People that have more risk to themselves, people that are older, people that have significant underlying conditions, need to make that decision for themselves, and then need to do that in an educated fashion. I think discussing that with one's primary care doctor is a good idea. The COVID hotline that we maintain can help walk people through that as well. But point being, if one is at increased risk for severe conditions, then their calculus of whether to go to a Mardi Gras event or any other event is different than someone who is younger or otherwise lower risk. The Biden administration announced a couple of weeks ago that they'll be distributing about 400 million free N95s throughout the country. This is where individuals can go to get those free N95 masks. Any Winn-Dixie in the state, most Walmarts in the states and Sam's Clubs, and a decent number of Walgreens locations. We'll post this online as well, but these are the pharmacy locations that are distributing the federal free N95 masks that President Biden announced a couple of weeks ago. I'll also note many community health centers have N95s and KN95s that they can give to their patients as well. We'll talk a little bit about the community support hotline and contact tracing. You know, the endeavor of contact tracing has changed throughout the course of this pandemic. And we had mentioned about a month ago or so that because of the particularities of the Omicron variant, the emphasis on contact tracing was transitioning a little bit to a more supportive model. So as of about today, individuals who test positive are no longer being called by contact tracers. What we have found in the Omicron variant is, number one, the sheer volume of cases, 14,000 cases day and day at the peak of this, prevents adequate contact tracing in the way that we had initially envisioned it. Number two, because the incubation period of the Omicron variant is a little bit shorter, the window in which a contact tracer can actually intervene before the die is cast, so to say, is much smaller, essentially to the point that it becomes a less efficacious intervention. And third, there are more and more people finding out that they're COVID positive with an at-home tests. Those at-home tests never get reported to the state, so the contact tracers don't know about those cases to begin with. For those reasons, contact tracing is less important an intervention now than it was at the onset of this pandemic. There was a nice statement put out a couple of weeks ago from a number of organizations together. It was the Association of State and Territorial Health Officers, it was the Association of Public Health Laboratories, the Council on State and Territorial Epidemiologists, and the Association of Community and City Health Centers. They all put a joint statement out that pointed to these changing priorities with contact tracing and how contact tracing is not the intervention that it was at the front end of this pandemic. At this point in time, what we want people to know is if they have questions, any questions related to being COVID positive, being exposed to COVID, how to isolate, how to quarantine, when to do those things, they should call the COVID-19 Community Support Hotline. The number is here, it's 877-766-2130. That's the best resource for anyone who has questions about, I was exposed, what do I do? I'm positive, what do I do? I don't know if I should test. That's where those questions should go. People who do test positive should no longer expect a call from the contact tracers for the reasons that I mentioned. But if they have questions about what it means and what they should do, this resource will remain available to them. I'm going to pause there. I'm going to turn it over to Theresa Sokol to talk a little bit about revised guidance in the K through 12 and the daycare setting. And then once she's done, we will open it up for questions and have a discussion. Theresa.
Thanks, Dr. Kanter. I did just want to make two brief points about contact tracing and the changes that are occurring there. Newly infected individuals whose test results are reported to LDH will not receive a phone call. However, they still will receive a text message if we have a cell phone number available for them. And that text message will provide some general information about COVID prevention. It will not disclose anything about a positive result, but it will also provide the inbound calling line, the COVID support line, so that it's easier for folks to be able to reach that. And I also want to mention that one of the services that we've provided through contact tracing has been to be able to provide resources to support people in their efforts to isolate and to quarantine. And we will continue to have that resource support available through the inbound line. Okay, so now I'll move on to schools and early childhood centers. So as you all may know, we have revised public health recommendations for K through 12 schools and early childhood centers. And this really is to allow for alternatives to the standard CDC quarantine guidance that we have previously, the LDH has been recommending. Now, these options are really intended to provide additional support for in-person learning for K through 12 students and for the daycare students as well. And we want to do this, we try to provide options that allow them to do this as safely as possible. Now, while CDC recommendations are going to provide the highest level of protection against transmission in these settings, what we have found is that full adherence to these guidelines really has posed significant operational challenges to schools and daycares, particularly during the Omicron surge. So we're hopeful that providing alternatives will allow these settings specifically to choose a mitigation strategy that confers a level of protection, but also is best suited to the unique needs of their own school community. So I just want to point out one clarification. I know a lot of folks on this call follow COVID very closely and probably are aware of this, but we do still get a lot of confusion about this point. Isolation recommendations are for people who are sick or test positive. And that isolation guidance is not changing. It applies to everyone regardless of vaccination status. And so isolation, again, 5 days with symptom improvement, and we ask people to mask for an additional 5 days after they leave isolation from their home. Now, the revised K through 12 and early childhood guidance is related to quarantine, the options for quarantine. And this is for people who've been exposed to COVID-19 but are not experiencing symptoms. So let's start off with K through 12. K through 12 has both, actually K through 12 and early childhood have 3 options. The first option for K through 12 is the standard CDC quarantine guidance for K through 12 schools. This is the safest protocol. Some schools may certainly choose to continue implementing this. I spoke with one today that seemed to be leaning in that direction, one school district. And this includes quarantine exemptions for fully vaccinated students, students who've received 2 doses of their mRNA vaccine, and staff who are up to date, meaning they've completed their series and they are boosted if they're eligible. Also, for those who've been infected within the past 90 days, they're also exempt from quarantine. These individuals do need to mask for 10 days when they return, and ideally they would test at day 5 just to be on the safe side and try to catch any cases that may pop up. The second option is a test to stay option, and this is for students and staff in K through 12 schools who are not exempt from quarantine. Please note that this option still requires contact tracing on the part of the school. Those, of course, who are exempt from quarantine, that guidance doesn't change. They need to mask for a full 10 days, test on day 5 if they can. Those who are not otherwise exempt from quarantine, they can be allowed to return to school rather than quarantining for the recommended 5 days. However, they have to test twice during that first 5-day period when they would otherwise be quarantined. And then they need to mask for the full 10 days after they return. The next option is what we're calling a universal masking option. And essentially what that says is there are schools that require, that mandate masking, universal masking of students and staff and visitors and everybody else who enters the school. Then no contact tracing or quarantine will be required regardless of vaccination status. And this is really to help address some of the difficulties that schools were having during the Omicron surge, where they had so many cases that they were actually not able to operationalize that contact tracing. So offering this option where the universal masking is in place is going to add this additional layer of protection. Okay, we can move on to early childhood. All right, so the options that I'm going to describe for early childhood are different than those that I described for K through 12. And this is because most young children are not able to correctly and consistently mask, and none are yet eligible for vaccination. So they've always been a little bit different. Now, these options are specific to early childhood students. Quarantine recommendations for staff members are going to follow the community guidance. So for the students, the safest option, CDC guidance, and that is that all close contacts quarantine at home for a full 10 days. Again, because they cannot mask consistently, so they can't do the 5-day quarantine, return for 5 days mask. So that's the safest option. The next option, the next tier, sort of in level as far as safety is concerned, is a little bit of a hybrid approach. Close contacts quarantine at home for 5 days after exposure. That really is the highest risk period. Then they can return to the daycare center. Of course, they have to be asymptomatic. And then they test twice during the next 5 days following their return. So the third option, which is sort of what we're talking about as kind of an acceptable option, it's not ideal. Close contacts do not have to quarantine at all. They have to remain asymptomatic, but they have to have a COVID test administered 4 times over that 10-day period, twice during the first 5 days and twice during the second 5 days. And of course, for all the early childhood and K through 12 quarantine recommendations, anyone who develops symptoms must be immediately isolated and tested. So in a nutshell, that's an overview of our options, and we're sort of sincerely hopeful that this provides some good alternatives that can support that in-person learning for the students in our state. And I'm going to pass it to Michelle.
Thank you, Theresa and Dr. Kanter, for that great presentation. We are now opening the floor for questions. Remember, only members of the working media are allowed to ask questions. And also, if you have any questions, please put them in the chat with your name, media outlet, and your question, and I'll take them in the order received. Any questions? Okay, we do have a question. Who is this from? Can you put in your name and media outlet?
Yeah, it's JC. I'm with the Louisiana Illuminator.
Okay, just to clarify, this is guidance. So school systems do not have to use all these options at all?
Thanks, JC, for the question. So as the governor said yesterday, I believe, in his press conference, he'll be re-signing the emergency proclamation either today or tomorrow and releasing it with the expectation that some of those provisions are going to either be changed or disappear from the proclamation in the next 28 days. So I don't want to get ahead of him in that. If the governor's order removes the school masking provision from there, then it would be up to BESI or individual districts or schools to set their own practices. We provide best practice guidance in that setting. As you see here, I think a lot of schools are trying to balance a number of priorities here. We clearly need to get kids back into school, minimize disruptions. The disruptions that we had to in-person education during this past Omicron variant was substantial. There's no question about that. But we have to find a way to do that safely. So we believe the options that we're presenting here and are available in writing are a good, safe, practical way to do that. And they help schools develop policies that they think are operationally sufficient for what their operations are.
Gotcha.
And
So you're
Dr.
sort of,
Kanter,
yeah.
Go ahead.
What, JC? I'm sorry.
Yeah. So you're saying that, it sort of depends on what the updates are to the governor's proclamation update in terms of what school systems are required to do.
Yeah, I mean, the governor did, hint what he was intending to do yesterday. I just don't want to get ahead of him until the document's actually signed.
Thanks.
I just want to add that, there are, most schools want to be able to provide a level of protection for their students and for their staff members as well. And I was on a call with the superintendents from the central and northern part of the state this morning, describing these options and outlining these options and answering some questions from them. And I can say that the reception was all very positive. They were very interested in having these alternatives and being able to implement some sort of mitigation strategy that might work for their school system.
Thank you. The next question is from Austin, WAFB. Mardi Gras 2 years ago was considered a sort of fire-off event for COVID. With these large gatherings and parades returning this year, what level of concern is there about a spike coming from Mardi Gras this year?
Hey, thanks, Austin. It's a great question. I think it's on everyone's mind right now. There's no question going back to 2020 that Mardi Gras was an inciting event for the surge based in New Orleans at that point in time. It wasn't the only inciting event, I have to note, because there was we had a number of conventions that we had cases tied to. We had cruise ships that we had cases tied to at that point in time. So it wasn't the only one, but it certainly was a significant one. Yeah, I think that the timing of this Omicron surge is somewhat fortuitous to us. We're coming down now as the carnival season is getting going. And I think there's a decent chance that we'll be either at baseline or pretty close to baseline come Mardi Gras Day, just looking at the progress that we've made now. I do have concerns about the events that are happening now. Earlier Mardi Gras events, parades happening last weekend and this weekend, certainly balls. I think balls in particular are higher risk activities. I don't, listen, I mean, to be completely honest and fair, it's impossible to predict what's going to happen with COVID. And every attempt that we've had to do that, we've been humbled in that process. That said, I don't see Mardi Gras causing us to have another spike, particularly because of the timing of where it's falling and it's coming down. It has the potential to perhaps delay and prolong our downswing, so to say. We've not seen evidence of it happening yet, but it certainly has the potential. What I'm more concerned about is families and individuals having the tools and having the resources to, number one, make an informed decision for themselves and protect themselves if they would like to do so. There is a recognition, and the school guidance ties into well, that 24 months into this pandemic, the next 24 months are not going to look like the prior 24 months, and that's a good thing. And because we have more ways to protect ourselves, more tools, there's more opportunities for families to make the decision for themselves. I think that's, in essence, where Mardi Gras falls. I want to help people understand what the risk to them and their family is, and I want to help them protect themselves if they want to take added protections. And that's the attitude that we're carrying forward throughout Mardi Gras.
Doctor, just a quick follow-up on that question, if I may. Should families and people should they feel comfortable going to a Mardi Gras parade? Is it safe for them to attend these events?
Everything is a scale. Nothing is 100% risk-free. It's important to be honest about that. I'll tell you what the high-risk activities are. I'll tell you what the lower-risk activities are. Going to a ball indoors is high risk. And people eating and drinking, clearly taking off your mask to do so, that's a high-risk activity. It doesn't mean that it's banned. It just means that it's higher risk, and people need to, take that into consideration and take added precautions if they choose to. Going to a parade, if a family is not in a thick crowd, if they're towards the back, if there's space around them, that's lower risk. It's not zero risk, but it's lower risk. If it is crowded at a parade, if they mask, that's a way to do it in a safer fashion. Nothing is 100 or 0%. It's all shades of gray in the middle. And I think families need to realize that. But look, I mean, my family will be going to parades. We'll be staying in the back. If we happen to find ourselves in a thicker crowd than we anticipated, we'll be wearing a mask. That's how I'm going to keep my family safe.
Thank you,
And
Dr.
I'll
Cantor.
add
A
that
question
there
from,
is-
a question
there is
from,
also-
I'm
Oh,
sorry,
so I
Theresa,
just
go
want to
ahead.
add one thing.
Yes.
Folks, if folks are not boosted yet, there's still time for a booster dose to really confer a lot of good additional protection. So that's another step people can take in advance of the upcoming Mardi Gras activities.
Okay, thank you. We have two questions from Christina from WDSU. We know cases are going down because more people are using at-home tests. What data are you all focusing on to determine getting out of the surge?
Hey, Christina, it's nice to see you. Cases are not going down because there's more at-home testing. When we look at the data to try and determine where we are in a surge, going up, going down, peaking, we look at a multitude of data points. The number of new cases getting diagnosed is one of those data points. Clearly, people that test at home, we don't find out about those tests, and that doesn't enter into that data point. But if people get sick of COVID and need to be hospitalized, regardless of whether they had their initial test at home or not, and if they get hospitalized, we find out about that. So there are other data points like percent positivity, like COVID-like illness, like hospitalizations, that in totality give us the visibility that we need on where we are in the pandemic. So, you know, the proliferation of at-home tests is a good thing. It gives people tools. You get your results in 15 minutes as opposed to 1 to 2 or 3 days. All of those are really good. And I do not feel that from a public health perspective, from an epidemiologic perspective, we have lost any visibility on the trajectory of the pandemic. You know, certainly the overall number of cases is higher in real life than what we're able to report because of the number of at-home tests. But given the other data points that we have, I don't think we have any lack of visibility of where we are in the pandemic. We peaked, we're coming down, we're very confident in acknowledging that. I'm sorry, Michelle, I forgot what the other question was.
Okay, the second one is, with hospitalizations going down, deaths appear to be rising compared to the beginning of this surge. What's the ratio of people leaving hospitals alive versus those unfortunately passing from the virus?
Listen, it's the issue to realize is that deaths are a lagging measure. And whereas the hospitalization count is real time, you know, at this point in time, snapshot in time today, there are 1,088 COVID positive patients in hospital beds throughout the state. The death count is a lagging measure because, first off, when someone dies from COVID, they typically have been sick for 1 or 2 weeks prior to that. And then it takes some time, 2 weeks, maybe even more, for a coroner to do their investigation, to certify that death, and then report it to us in the state. So, for example, we reported 42 COVID-associated deaths today. Those are not 42 people who died today. There's 42 people who died at some point in the past 2, 3, or 4 weeks, but the reports came to us today. So the deaths are a lagging measure. We're going to continue to see the deaths be higher than we would like for the next few weeks, reflective of what happened 2 or 3 or 4 weeks ago.
Thank you, Dr. Kanter. Appreciate you.
Thank you. Jacqueline from WVLA has a question about why are some places losing their mask mandate when, according to our website, it shows all parishes are at a high level of risk.
Jacqueline, you referring to other states or to places within Louisiana?
It just shows on your website, like all like your parishes, like it all shows like you're at high risk for the community. So within Louisiana, like your parishes.
Yeah, you know, there's 2 things to consider. There's what's your risk of being exposed to COVID? You know, how much COVID is out there? If I go out about, you know, if I make groceries, if I go, you know, on my day's business, what's the likelihood that I'm going to be exposed to the virus itself? And that's what that community risk measure shows. And you're right, it's still high in all 64 parishes. It's lower than it was 2 weeks ago. significantly lower than it was 2 weeks ago, but still, because it was so high 2 weeks ago, it's still high, and it's going to be high for another couple of weeks until we have time to come down to a more baseline level. The other side of that is what are the consequences of that, and what is my ability as an individual to protect myself? And so when you talk about a mask mandate, you talk about whether it makes sense to order masking across the setting, you have to factor all of those in. You also have to factor in how stressed out, stretched the hospitals are. We're in the totality of that. Hospitals are in a better place now than they were at the peak of this surge, and certainly than they were at the peak of prior surges, because for a couple of reasons. Number one, on average, this variant is milder. It's not on average making people as sick as before, and we have more people vaccinated than before, and we have more people that had a exposure than before. So all of those combine to lessen the degree of burden on the hospitals, and individuals have more ability to protect themselves now than they did a year or a year and a half ago in the pandemic. They can get vaccinated and boosted if they choose to do so. They can obtain a high quality KN95 or N95 mask. That just wasn't possible in the first couple of months of the pandemic. And we have better medicines now to treat people who do get sick. So in totality, I think it makes sense for a lot of places to reconsider the mandates that they had. Certainly, there's no statewide mask mandate in place, and those are some of the reasons behind that.
Thank you. Our next question is from Emily Woodruff with the Times-Picayune. To clarify, LDH was previously following CDC guidelines for school quarantining, which also allowed schools to opt out of masking, right?
The prior guidance, which is the governor's order that expires as of tomorrow, had a clause that the masks were mandated in the school setting, but a school or district could proactively opt out of that mandate if they were following the LDH and CDC quarantine guidance. That's the way the order read, as of yesterday and today. Again, I expect there'll be some changes to that when the revised order gets issued either later today or tomorrow. To the larger point, you're right, Emily. The guidance that we just put out, that Theresa walked through, is different than the CDC guidance. And it's important to recognize that. The CDC is trying to issue guidance that makes sense for a very diverse country. Something that makes sense both for New York City and for rural Utah and everything in between. Our job here is to look at what our situation is, look at what the challenges are in Louisiana, and issue guidance that makes sense for Louisiana. I think at many points in the pandemic that the CDC guidance did make sense. At this point right now, particularly coming off of this Omicron surge, I think it's reasonable to give schools options, other options to keep kids in school without disruption and to do so safely. And that's the point of the guidance that's issued. Different than what the CDC offers, but I think that's appropriate at this point in time in the pandemic.
And Emily, just CDC guidance actually does recommend universal masking for students and staff in K through 12, so you know.
Okay, thank you. Another question from Christina from WGSU. What's LDH's response to AG Jeff Landry joining a lawsuit suing New Orleans top leaders about vaccine and mask mandates, which are in place through carnival season?
Don't have a formal LDH response. The governor's been clear that he supports localities, municipalities, and parishes' ability to institute more restrictive measures if they feel the need. New Orleans certainly is at risk. They bore the brunt of the initial surge, which is one of the first outbreaks, not only in the state, nationwide, and they have Mardi Gras, where there not only will be a lot of gatherings in the city, but they have a lot of people coming in from outside the state, outside the country. So they have particular risks that not everywhere in the state shares. So no official comment other than to say the general premise that localities can make more restrictive measures if they feel the need is something that we support.
Thank you, Dr. Kanter. Are there any other questions? If not, I'll turn it back over to Ally.
Hey, everyone. Thank you so much again for joining us. As a reminder, we will be making this recorded briefing available. We hope in the next hour that will be available via YouTube. So thanks so much for joining us, and please follow up with me and Michelle if you have any other questions. Thanks, everybody.
Thank you.